thinking about pretty much the same thing that the previous group. So we're also trying to find the ways to make the patient take his pills, and we're also thinking about the device that will give you out the right amount of pills at the right time. But we're also thinking about the feedback, but not to the patient, but more to the doctor. So we thought the device should be online and sending all the information to the doctor's office, at the time that it takes your information. And if we talk about the differences, we're thinking that we should have every morning the patient should have some kind of a checklist, just to check, for example, for the side effects that the drugs he's taking might have. Maybe check some take a drop of blood, or if we're talking future, maybe even have to do an invasion into the body. So check the levels of whatever that was.
Yeah, that's
stuff. And to give the information to the doctor if you need to change the dose, or if you need to take the drug off because you have any side effects or anything. And we were thinking how it should look like. We thought it's not very portable. You can take it to jogging or anything because you have pills in it and everything. But it should be very user-friendly because it's mostly, when we thought about who would use this device, it's mostly old people who forget what pills to take and when to take them. So it should be with a big display and maybe touch screen, voice control, something like that. So it's not very small, not very big, not exactly what shape, I don't know. So, you want to add something? And we thought that the drugs should be made into the smallest possible size, maybe, which you could still take from there, not to make the device itself too big. And I don't know, maybe have some medical personnel come once a month, check you if you're using it.
The advantage could be that maybe old people are taking 7 or 8 different pills and with different drugs in there. And so the machine could maybe mix all these different drugs into one pill so that the patient just have to take one pill. So the patient wouldn't mix up the different medications. And maybe in the morning the patient would just put one thumb on the machine, and the machine is measuring the drug levels in the blood, for example. And then the machine could be put more drug of these type A into the one pill, or lower the dose so that you have always the perfect amounts of the drug in your blood, so that there would be a lowering of side effects, for example.
But it pretty much works also on the trust the patient, because you can monitor the patient all the time. So that's pretty much it. Yeah. Questions?
Questions and criticism? Notes?
I think the biggest challenge always is that the machine is too bossy. So if it says, yeah, take now. Sometimes it's okay, I just push away that machine then. So that's the challenge we also face with that device.
So we can make some kind of connection with the aura.
Exactly.
So what do you think, how often does the patient see the doctor then, when the machine is measuring all the blood pressure and say, oh yes, a little bit more of this, a little bit more of this, I mean, there's still the contact.
We thought that we should have some kind of medical personnel, like a nurse or somebody come and check you every once in a while, every month or every week. And if something is bad, like we said, it should be not inside of painful. If something is going badly, having side effects or having some effect on your liver or whatever, then you should give some notification to the doctor or to you, call your doctor.
It's actually an everyday checklist, so it's good to put it online for the time.
Okay, thank you.